Hello, I'm Dr. Beth Cronin. I'm an OBGYN here in Providence, Rhode Island, and wanted to thank you and the members of the House of Representatives Judiciary Committee the opportunity to speak tonight. I'm here today on behalf of the American College of Obstetricians and Gynecologists, otherwise known as ACOG, to speak in opposition to Bill H7026. The Rhode Island section of ACOG represents more than 140 physicians and partners who are committed to providing safe, evidence-based health care for the women in our state. I am alarmed to see that this bill is an attempt to prohibit women from accessing safe health care in the state of Rhode Island. Bill H7026 would create an unsafe environment for patients by preventing their physicians from having every option available when providing care. This bill would place physicians in the unconscionable position of having to deny a woman an evidence-based treatment with the fewest complications. It is dangerous for legislators to presume that they are better equipped than experienced physicians to judge what treatment approach is appropriate for every patient in every circumstance. Most second trimester pregnancy terminations are performed for fetal anomalies or for the health of the mother. Fetal development is a complex process that can tragically go awry. In the case of some severe birth defects, there is no medical treatment that can save that child's life. Bill H7026 does not even include exceptions for these situations, in effect, forcing a woman to carry a pregnancy and deliver that pregnancy with no hope of survival for the child. These medical decisions should be made by each individual woman in consultation with her family and medical providers. If her decision is to end the pregnancy, her OBGYN needs to be able to offer the best, safest procedure. As physicians, we are trained to assess the needs of our patients, consider all treatment options, and select the most appropriate procedure for each situation. We have the medical knowledge and expertise to perform these procedures when necessary and know when other options are best indicated. Banning specific types of abortion procedures would leave physicians unable to provide medically appropriate care. This is unjust. ACOG's statement of policy on legislative interference states that laws should not interfere with the ability of physicians to determine appropriate treatment options for patients. ACOG strongly opposes any governmental interference that threatens communications between patients and their physicians, or causes the physician to compromise his or her medical judgment about what information or treatment is in the best interest of the patient. When I enter the operating room to perform a hysterectomy, a procedure in which the uterus is removed from the patient, I determine the type of incision to make based on multiple clinical factors. To allow for successful operation, it is necessary that I can make this decision without restrictions. You trust that I have enough clinical training and expertise to determine how I approach a hysterectomy, which is why there are not laws about hysterectomy technique. Determining the technique used in performing an abortion should be no different. We all deserve to enter our doctor's office confident that the care we receive will be based on solid scientific research and experience, and not based on a political mandate from the State House. Just like you want your doctor to have all the access to all of the best scientifically proven treatments for you and your family, I want the same for myself and my patients. I recognize that the issue of abortion is both politically and emotionally charged. Yet that does not justify the unwise and unsafe political intrusion into the practice of medicine. So on behalf of the American College of OBGYNs, I urge the House Judiciary Committee to reject this bill. Thank you again for the opportunity to present testimony.